In Sri Lanka, things are going from bad to worse. The economic crisis is turning into a health emergency. Hospitals are running out of important supplies. Pharmacies are running out of key medicines. Surgeries and treatments are being delayed. So, Sri Lankan doctors have joined the protest demanding urgent supplies.
They have swapped the scalpel for placards. Silently, they have gathered at this street in Colombo. Not the biggest protest you will see here, but arguably a more important one. Because these demonstrators are doctors and nurses. Maybe they have their own politics, but today they are here for the patients. Sri Lanka is running out of medical equipment. Around 85% of the pharmaceuticals here are imported. The forex crisis has slashed that trade. Many hospitals have no way to treat people.
We are feeling some sort of uncertainty that somehow we want, as a health worker, we want to function these services because this hospital is a very sensitive hospital. So we have to provide the services. Otherwise, as a health manager, I feel very sad if we are unable to. If we turn out the patients without giving treatment, that's very sad. Sad. At the moment, we are not doing. Somehow, we are managing all the patients.
The situation is pretty bad. Turning away patients is not an option. Neither is reusing critical medical equipment. Yet, that is exactly what some hospitals have been forced to do.
But for an example, the nebulization kits that we are using, that is like you nebulize wheezers in the emergency department. So we had been washing them and reusing it, which we didn't used to do it. But now, of course, we are worried that we might run out of the stock. So we had gotten to this habit of cleaning them, drying them and reusing it. So that's sad, but that's the reality.
Now the doctors have had enough. Hundreds of them are rushing into the streets of Sri Lanka. Their appeals are bringing donations from individuals and organizations. But experts say it's not enough. Almost 70 vital drugs are in short supply, including anesthetics. And this is forcing doctors to make heartbreaking choices.
From this week, we are trying our level best to curtail some non-urgent operations, but attend all the emergency operations. And we are hoping that there will be some supplies coming from our friends in India and other countries, which will ease things out. But I think we are in a very serious situation, so we will have to be very, very careful.
It is the same story at pharmacies. Some have barely 2 months stock left. Others are turning away regular customers.
Bad because for the past 6 years, this company, Unicus, have been serving customers as well as serving patients in getting their prescription medication done. And so when you hear in the last few weeks that we won't be able to, or not only us, the entire medical system in Sri Lanka won't be able to offer the correct dosages for its patients, it's very heartbreaking. So that's.
Without swift intervention, the situation could escalate. It started off as an economic crisis, then became a political crisis, and now is on the verge of becoming a humanitarian crisis. South Asia Bureau, WION World is One.